Well, good morning, everyone, and thank you for joining us. I am Dr. Shafiq Ahmed. I'm the interim president of Howard County General Hospital. And with me today, I have a very special guest, Dr. Mark Landrum. He is the chief of infectious diseases at Howard County General Hospital. And we thought today we could go through a few general questions that gives a little bit of guidance on how to manage around COVID as we are seeing a fall surge. We thought it would be very helpful for you, so I'm going to be asking him some questions. I know certainly they're at the top of my mind, and I'm sure they're at the top of yours. So if it's okay, Mark, can we go ahead and get started?
Let's go.
All right. So first question, Mark. Is it safe to travel and spend time with family during this time?
So the quick answer on that is not really. The challenge is many times this is such an important time of the year. You've got a lot of festivals. You've got a lot of celebrations. Thanksgiving is right around the corner. Everybody is frustrated with being locked down for COVID, and you just want to see family. If you have a family gathering where there are 10 people and no one's infected, no one's going to get COVID from that. But if you have a family gathering where one person is infected and you have 10 people in the room, you can count on 4 or 5 of those people getting infected from COVID. So the stakes are incredibly high, and you have to think about who's coming to that gathering. If you've got an elderly parent, a relative who has health concerns, you just really need to take it slow and really consider canceling or very, very strongly limiting the number of people who are going to be at that gathering. A large family gathering like you might traditionally see for Thanksgiving is just a terrible idea this year. And we're seeing the rise in community numbers that are kind of giving you an idea of what's to come, I think, on this second surge.
So let's just say you're forced to travel, and it may not be for a gathering, but you do need to travel, and there's some other personal reason or professional reason that you have to travel. How can you limit your risk?
This is such a tough question. So let's say you're on a plane. If you're on a plane, when I'm traveling, I had to travel last month for something, and I was on a plane ride for a few hours. The most important part is wearing your mask. I would say hydrate before you get on the plane so that you're not taking your mask off while you're traveling. Try to not take your mask off during the course of your time at the airport, but be as safe as possible. So hydrate ahead of time so that you don't need to have something to drink frequently during the course of your travels. Keep that mask on the entire time. If you can do something to protect your eyes, that's the other area where we're concerned about transmission. So a droplet, if someone's coughing, if there's something that you're within 6 feet and you have a way of protecting your eyes, that's ideal. So you might look a little silly on an airplane, but if you have a way of having a face mask there, it may protect you so that you're not going to pick up COVID during the course of the travels. Personally, when I travel, I carry a little miniature travel packet of disinfecting wipes. And I know they're doing a lot on airplanes and the airports to sterilize surfaces, but I always take my wipes out. I wipe down my tray table. I wipe down the armrests. I'm in that same spot for 4 or 5 hours, perhaps, in just a 2 or 3 square foot area, and there's nothing around. If I'm going to touch surfaces and rub my eye, that's where you worry about transmission of any virus, not just COVID. So if you're able to get hold of some kind of a sterilizing wipe, I would use that. Hit the surfaces. Make sure that if people are traveling with you as well, that they have those same standards, because this gets into the other issue is when you get off that plane, your other mechanism of travel is going to be a car. If you're in a car and you're in a car for 4 or 5 hours, if one person in that car has COVID, everybody in that car is going to have COVID. You've got an enclosed space, limited air exchange, and it's just an incredibly high risk. So carpooling with somebody to an event, not a great idea. If you have to travel and you're in with your own family, I don't think the risk is going to be significant, but you do need to pay attention to what the risks might be.
So Mark, how about using glasses? Is that okay for eye protection?
I think glasses are better than nothing. I trained, as you know, as internal medicine and pediatrics, and very, very early on in my medical training, I decided that looking good with contacts was not important to me. I'd rather have my glasses in case somebody's coughing right in my face. So I've got my glasses off for the purposes of this, so I can see the screen, and that's just getting older and needing bifocals. But when I'm walking around anywhere else, I've got my glasses on, and I think that's another layer of protection. Is it ideal compared to a full face shield? No. If you've got a full face shield or you can get a temporary face shield, I think that's better than glasses, but absolutely glasses are going to be better than nothing. and really you just want not to touch your face. The most important part is not touching your face.
Well, that's good news, Mark. I appreciate all of your input this morning, and thank you personally very much for all of the wonderful work that you've done. Speaking as the incident commander for our COVID response in the hospital, I could not have done this without you as a partner.